him really tight. Can you hug really tight?
All parents want the very best care for their children. There's a lot to think about when choosing an early learning program that best meets your family's needs. It is important to educate yourself on various options to choose the care that is best suited for you. Start your search as far in advance as possible. Visit several programs and visit the one you like more than once. Care may be provided by a program that is licensed or registered through the Texas Department of Family and Protective Services Child Care Licensing Division, or by the relative of the child. All facilities that are licensed or registered through child care licensing must meet state standards for providing child care at all times. These facilities include registered child care homes. These homes care for up to 6 children, ages birth through school age, and up to an additional 6 school-age children. Care is provided in the child care provider's own home. Licensed child care homes. These homes care for up to 12 children. There is typically at least one other adult caregiver in addition to the licensed provider. Licensed child care centers. These centers care for 7 or more children at a location that is not the child care provider's residence. The staff of these facilities must meet minimum training requirements related to care and education of children, including CPR and first aid certification. Facilities are inspected by child care licensing on a regular schedule and/or as violation reports are received. Parents may also choose relatives, friends, or neighbors to care for their child. Individuals who care for 1 to 3 children that are not their own children will list with child care licensing and undergo a background check as well as a sex offender registry check each year. There are no state standards for listed care and no inspections are done. Some parents find this type of care more convenient for their families since it is typically someone they know or who is nearby their home. Parents participating in the Child Care Assistance Program can choose a relative as their provider. However, that relative must list their name with child care licensing. While all regulated programs have state rules and regulations they must follow, those standards are the basic requirements. Find out what those requirements are and get information about complaints and violations for the facilities you are considering by visiting www.dfps.state.tx.us. Many programs go beyond the basic requirements and adopt quality standards for child care and the early learning processes that support literacy and school readiness. The following information may be helpful as you consider your options for care and search for a quality program. Child care programs may choose to complete a voluntary accreditation process through a national organization and adhere to stricter standards. Achieving accreditation involves extensive self-study and validation by professionals outside the program to confirm that quality standards are met. Some of the more commonly known national accreditation agencies include the National Association for the Education of Young Children, or NAEYC, National Early Childhood Program Accreditation, or NECPA, National Association of Family Child Care, National Accreditation Commission, or NAC, and the National After School Association. School Ready Certification. These programs use qualified teachers, formal curriculum, and research-based practices. They provide ongoing professional development for staff and monitor the development and progress of children in their programs. Once children enter kindergarten, their progress is tracked. The facility is certified as school ready, based on outcomes and performance of the children once they are in public school. Other certifications. There are other types of certification for subsidy programs that exceed the state's minimum licensing standards. When visiting a child care facility, ask the provider if they have any certifications or accreditation. When you are ready to visit, call ahead and schedule an appointment and plan on staying for at least an hour. You should watch activities, look at the environment inside and out, and ask questions. Caregiver-child interaction is the most important indicator of quality child care. Here is a list of things you should consider. Does the caregiver seem to really like children? Are the children greeted by staff when they arrive? Does the caregiver get down on the child's level when speaking? Are children's needs met quickly even when things get busy? Is the caregiver trained in CPR and first aid? Is the caregiver involved in continuing education programs? Is the caregiver willing to answer your questions? Does the caregiver communicate with the parents about the child's day? Are the parents' ideas welcomed, and are there ways for you to get involved? Does the caregiver and children seem to enjoy being together? Is there enough staff to meet the needs of the children? What kind of experience does the caregiver have? And does the caregiver participate in professional development opportunities? Pay attention to the setting of the child care. It can instantly put you and your child at ease or cause stress. Take note of the following. Is the atmosphere bright and pleasant? Is the environment clean and well maintained? Is the outdoor play area safe and offer a variety of equipment for different ages? Can the caregiver see the entire playground or play area at all times? Are there areas for resting, quiet, and active play? Is there space to store your child's belongings? And are there things that would make the child feel at home? A safe and healthy environment is important as well. You should consider the following. Do all caregivers and children wash their hands often, especially before eating, after using the bathroom, wiping noses, and changing diapers? Are the restrooms clean? Does the program have first aid kits? Does the program practice fire and emergency drills? Are the indoor and outdoor areas inspected regularly for broken equipment or health hazards? Ask to see sample menus. How and when are meals served? Do the children and caregiver brush their teeth after eating? Activities throughout the day not only keep children engaged, but provide opportunities for growth and learning. You should observe the following. Is there a daily balance of playtime, group time, individual activity time, and nap? Is there a regular daily routine? Are activities planned and prepared ahead of time and appropriate for age groups? Are there enough toys and materials for the number of children? Are toys clean, safe, and within reach of the children? In general, you want to be sure the program's practices and philosophy match as closely as possible to yours. Do you agree with the discipline practices? Do you hear the sounds of happy children? Are children comforted when needed? Are surprise visits by parents encouraged? Will your child be happy there? We encourage you to take these 5 important steps when visiting a child care provider. Look, visit the facility you like more than once during business hours to get a feel for what the care will be like for your child.
Very good. Yes, you did. Very good. Now count it. How many is this?
Okay.
Listen. Adult voices should be cheerful and pleasant. The children should be happy and involved in activities. Babies should not be left to cry for long periods of time. Count. Count the number of children in the group and the number of staff caring for them. A small number of children per adult is especially important for babies and young children. Children should never be left in a room or area without an adult. Ask. Ask about the background of all staff and if they have any special training. Inquire if the program is accredited or certified. Ask about the daily activities and routines, processes for guidance and discipline, policies for when children get sick, food service, and the personal items you need to provide for your child. Be informed. Call or go on the Child Care Licensing website to find out if there have been any valid complaints and other pertinent information about any of the programs you are considering. Once you have chosen a program, stay involved. Talk with your child's caregivers each day. Schedule a meeting if necessary. Offer to volunteer. Be there for your child's birthday party or other special events. Visit your child's classroom to read a book or do activities. Being involved gives the message to your child's caregivers that your child is important and you value the program you have chosen.